Why do neurologists use a spinal tap for diagnosis? Imagine being able to peek directly into the fluid surrounding your brain and spinal cord to find clues about what might be going wrong. That's exactly what a spinal tap, also called a lumbar puncture, allows neurologists to do. This procedure is a key step in diagnosing many neurological conditions. Neurologists use a spinal tap mainly to collect cerebrospinal fluid, which is the clear fluid that cushions and surrounds your brain and spinal cord. This fluid contains important information about your central nervous system. By analyzing it, doctors can see if there are signs of infection, inflammation, bleeding, or abnormal cells. This helps identify conditions like meningitis, which is an infection of the membranes covering the brain and spinal cord. It can also detect encephalitis, multiple sclerosis, or bleeding around the brain known as subarachnoid hemorrhage. Sometimes, it helps find cancers that have spread to the brain or spinal cord. One reason neurologists relying on a spinal tap is because many diseases change the composition or pressure of cerebrospinal fluid before other symptoms show up or before imaging scans reveal anything. It gives a direct look at the biochemical environment of the central nervous system, which blood tests or scans might miss. The procedure involves inserting a very thin needle into the lower back, between the bones of the lumbar spine. Local anesthesia is used to numb the area so it's not painful. The doctor then collects a small amount of cerebrospinal fluid, usually about 1 to 2 tablespoons. This fluid is sent to a lab for testing. They check the number of cells, protein and glucose levels, and look for infections or abnormal cells. Besides diagnosis, neurologists sometimes use a spinal tap to measure the pressure inside the skull. High pressure can cause headaches or other symptoms. They can also deliver medications directly into the cerebrospinal fluid, such as chemotherapy drugs or anesthetics, which need to reach the central nervous system quickly. Overall, a spinal tap is a safe procedure that provides vital information. It helps neurologists understand what's happening inside the nervous system and guides the right treatment. It's a powerful tool in the fight against neurological diseases, giving a window into the biochemical world that surrounds your brain and spinal cord.